Assalamu alaikum. Welcome to the fascinating world of VN correction. I am Savaira Saleem, a dedicated second year student at Munawwar Memorial Hospital, Chikwal. Topic I am going to discuss is retinoscopy. First of all, I have to introduce that what is retinoscopy. Retinoscopy is a technique used to obtain an objective measurement of refractive status of an eye by using an instrument called retinoscope. There are two types of retinoscopy: static retinoscopy, in which accommodation is relaxed, and dynamic retinoscopy, in which accommodation is active and target is at near distance. There are two types of retinoscope also. The first one is reflecting mirror retinoscope, that is divided into further two types: single plane mirror and plane and concave mirror. The second one is self-illuminating retinoscope, that is also further divided into spot retinoscope and streak retinoscope. Now the question is, what is streak retinoscope? In streak retinoscope, light source is linear, intensity and type of beam can be controlled, and exact axis can be easily found. It has two systems: projecting system and observation system. Projecting system include bulb, condensing lens, mirror, sleeve, and rheostat. And observation system include peephole, in which observer sees the retinal reflex of the patient. Then what are the principles of retinoscopy? It is based Record's principle. It states that the examiner should stimulate infinity at the working distance to obtain refractive error. What is working distance? The distance between patient's eye and the observer while performing retinoscopy is called working distance. Normally, it is 66 cm or 50 cm. To compensate the working distance, we use working distance lens. Instant identification of refractive errors are myopia, hyperopia, and astigmatism. What is the fixation target during performing retinoscopy? The target given to the patient should be 20/200 or 6/60 in Snellen chart. It is given to the patient to relax accommodation during retinoscopy. What are the requirements during performing retinoscopy? These are dim and 6-meter zoom, retinoscope, trial lenses, trial frame, and visual acuity chart. Now we talk about the procedure. Tell the patient about the test. The patient should be instructed to fixate the distant target. The patient's right eye should be examined with the examiner's right eye with the retinoscope in right hand and vice versa. Working distance should be maintained at arm length distance. The examiner should keep both eyes open. The examiner should stay as close to visual axis as possible. The examiner should not obstruct the view of the target. Two techniques to perform retinoscopy: wet retinoscopy and dry retinoscopy. In wet retinoscopy, cycloplegic drugs are used, which cause paralysis of accommodation and dilate the pupil. And dry retinoscopy is performed without cycloplegic drug. You should do retinoscopy on every person you examine. It provides starting point of refraction. It estimates refractive error in persons with difficult in communication, like babies, mentally unstable, deaf, and dumb. Thank you for listening. Allah Nigiban.